This is Unit 2 in Pharmacology. This unit is about GI problems, gastrointestinal problems. It primarily covers chapters 14, which is drugs for gastrointestinal problems. It does touch chapter 6, which is entitled Drugs for Tuberculosis, Fungal and Parasitic Infections. And of course, it always will touch chapters 20, which is over-the-counter drug therapy. We can understand that digestion begins in the mouth. This is where food is chewed and mixed with enzyme-rich saliva, which is secreted by the salivary glands. The food passes from the mouth to the anus through the digestive tract. During this passage, the complex compounds that enter the mouth as food are reduced into smaller dissolvable particles. And these are carried. The usable food particles are absorbed, whereas ingestible pieces and waste materials are eliminated. Accessory digestive glands, salivary glands, gallbladder, and pancreas secrete enzymes and other chemicals that are required to break down food substances and promote absorption into the bloodstream. In the stomach, digestion requires strong acid. This acid is referred to as hydrochloric acid, also known as HCl, to break down protein and other substances. However, this gastric acid is so strong, it has a low pH, that it could erode the cell lining, the stomach, and form open sores, also referred to or known as ulcers. Think of the burning sensation you feel in your mouth and throat and nose when you have vomit or an emesis. Fortunately, several factors work together to protect the GI tract mucosa from injury. One protective substance secreted by stomach lining parietal cells is a type of prostaglandin. This substance triggers the production of thick mucus that forms a gel-like layer in the stomach that helps prevent stomach acid and enzymes from coming into direct contact with and damaging the lining. Prostaglandins also maintain good blood flow in the stomach, which keeps these tissues well oxygenated and allows the immune system to help keep them healthy. As partially digested food and liquid leave the stomach and enter the duodenum, the first 12 to 18 inches of the small intestine, the stomach contents are still very acidic. The duodenum does not have the mucus protection that the stomach has, and it could easily develop ulcers from exposure to acid and digestive enzymes. However, the pancreas produces copious amounts of bicarbonate and secretes it into the duodenum to neutralize the acid in the partially digested contents from the stomach. Two problems that the digestive system can have are vomiting and ulcer formation. Other problems include the movement of stomach contents back into the esophagus, known as gastric reflux, also known as GERD, abnormally slow movement of the contents through the intestinal tract, known as constipation, and abnormally fast movement of contents through the intestinal tract known as diarrhea. This chapter focuses on drug therapy to prevent or manage these problems. The digestive tract can become infected with bacteria, viruses, fungi, and parasites, and drug therapy for these infections is also described. An antiemetic is a drug used to prevent and treat nausea and vomiting. Regardless of the cause, there are many classes of antiemetic drugs, including serotonin receptor antagonists, substance P antagonists, phenothiazines, cannabinoids, pro-motility drugs, non-phenothiazines, and anticholinergic drugs. Most work in the brain, stomach, and intestinal tract to change the sensation of nausea and to reduce the stomach contractions that make vomiting occur. Which class of drug is used depends on the severity of the problem and the patient's individual response. Some patients require a combination of 2 or more types of antiemetic drugs for the effective management of nausea and vomiting. The first 5 categories of antiemetic drugs are discussed here. The non-phenothiazines and anticholinergic drugs are the primary ones we're going to discuss. Nausea and vomiting are common GI problems that occur as a result of infection, fever, motion, certain foods, anesthesia, and exposure to many drugs, including cancer, chemotherapy drugs. Nausea and vomiting often occur together, or vomiting follows nausea. However, nausea can occur without vomiting and is still an unpleasant sensation. Vomiting also can occur without the cessation of nausea. Although we tend to think of nausea and vomiting as problems of the digestive tract, they result from a complex set of interactions that involve the brain, the nervous system, inner ear, stomach, and intestines. Messages from the cerebral cortex. An example: fear, anxiety. The sensory organs, an example of this is the sights, odors, pain, or the vestibular apparatus in the inner ear, such as motion sickness, can be sent to the vomiting center in the brain. These are called direct acting stimuli because the messages goes directly to the vomiting center. Indirect acting stimuli involves the chemoreceptor trigger zone, also known as the CTZ. For example, opioids, alcohol, certain antibiotics, and types of anesthesia can stimulate the CTZ. The CTZ then sends messages to the vomiting center. Signals from the stomach or small intestine can send messages to the CTZ, such as after a big meal or a food that does not agree with you. Think of the last time you felt nauseated and vomited. Was it a direct or indirect stimulus that caused the nausea and vomiting? A neurotransmitter is a chemical that transmits signals from one nerve to the next nerve in the pathway or in the brain. A major neurotransmitter that causes nausea and vomiting when it binds to its receptors is the CTZ, or the GI system. is a form of serotonin known as the serotonin 5-hydroxytryptamine type 3, known as 5-HT3. The serotonin 5-HT3 receptor antagonists are a class of antiemetic drugs that reduce or halt nausea and vomiting by blocking 5-HT3 receptors in the intestinal tract and the CTZ so that serotonin cannot activate these receptors. These antiemetics are used to reduce or prevent the nausea and vomiting resulting from cancer, chemotherapy, radiation therapy, and anesthesia-induced nausea and vomiting after surgery. These drugs may be called cetrans for short because their generic names typically end in the suffix cetron. The nursing implications: make sure that the patient has a call light available because these drugs can cause dizziness. Give the drug before the patient has an episode of vomiting because it can prevent or relieve nausea before the patient vomits. The oral dissolvable tablets dissolve in seconds after being placed on the tongue. After the tablet is dissolved, the patient may swallow. It does not need to be given with water. Contact the healthcare provider if the patient is also taking drugs that affect serotonin levels because the interaction can cause serious adverse effects. These drugs may be given for post-operative nausea and vomiting, but typically are delivered intravenously rather than orally. Examples of these drugs are ondansetron, known as Zofran, and palonosetron, known as Eloxy. The expected side effects: common central nervous system side effects of serotonin 5-HT3 receptor antagonists include dizziness, headache, and drowsiness. Some patients experience changes in taste, heartburn, constipation, or diarrhea. Rarely a patient may experience chills with shivering. The adverse reactions include allergic reaction, dysrhythmia, and renal or liver damage. Serotonin syndrome can occur if the patient is taking other drugs that increase serotonin, certain antidepressants, St. John's wort, though certain other antidepressants would include if the patient is taking other antidepressants that are already SSRIs. That would be paroxetine, which would be Paxil, or Citrolan, which is Celexa. These drugs can interact with a variety of drugs that contain the neurotransmitter serotonin or are similar to serotonin. Examples include monoamine oxidase inhibitors, MAOIs, morphine, and serotonin reuptake inhibitors. If 5-HT3 receptor antagonists are combined with phenothiazine drugs, patients may experience cardiac dysrhythmias. Some nursing implications and patient teaching: the planning and the implementation. In addition to the general nursing considerations related to care of the patient with an antiemetic drugs described, The following issues and actions are important to follow. Very carefully to ensure adequate timing before the patient receives chemotherapy. Monitor the vital signs before and after giving this drug and ask the patient about any abdominal pain. Severe pain can indicate infection, bleeding, or other severe problems in the GI tract. Follow up with your patient to make sure they are getting relief from their nausea. The drug interactions can interact with a variety of drugs that contain the neurotransmitter serotonin or are similar to serotonin. Examples include monoamine oxidase inhibitors, MAOIs, morphine, and serotonin reuptake inhibitors. If 5-HT3 receptor antagonists are combined with phenothiazine drugs, patients may experience cardiac dysrhythmias. Assess the heart rate, the blood pressure, respiratory, and level of consciousness before administering. Remove any foods, smells, or images that may make nausea worse. Ask the patient to describe his or her nausea, and if the patient vomits, record the color and consistency along with the amount. Give the antiemetic drug for nausea rather than waiting until the patient vomits. Vomiting can result in dehydration and electrolyte imbalances, so make sure to monitor the patient's weight, skin turgor, and intake and output. Review the serum electrolyte and report any abnormal results to the healthcare provider. If the patient is taking an antiemetic for chemotherapy, carefully review the patient's prescribed protocol to ensure good timing of the drug administration. Determine the effectiveness of the antiemetic by monitoring the patient's report of relief from nausea and no further vomiting. Tell the patient to ask for help when getting out of bed or out of the chair because of these drugs can cause dizziness and drowsiness. Be sure to have the call light within the patient's reach. Report any symptoms of severe abdominal pain or signs of abdominal distension to the healthcare provider immediately because these may be signs of complications. Report emesis that look like coffee grounds or is red tinged to the healthcare provider immediately because this may indicate bleeding in the GI tract. Tell the patient to avoid driving or using heavy machinery while taking antiemetics because they can cause dizziness and drowsiness. Teach the patient to contact the healthcare provider before adding any over-the-counter drugs or herbal drugs because they can increase the risk for drug interaction. Remind the patient to avoid alcohol, sedatives, and tranquilizers until specifically advised by the healthcare provider. Many of these drugs cause increased sun sensitivity, and patients must avoid direct sunlight without sunscreen and protective clothing. Teach the patient to rinse his or her mouth carefully with clear liquids after vomiting. Ice chips or mild-flavored popsicles may be soothing. Teach the patient to contact his or her healthcare provider if nausea and/or vomiting lasts for more than 2 days, or the patient is unable to take any fluids or has a fever. The patient and family teaching. Make sure that the patient tells the healthcare provider if they're taking serotonin, 5-HT3 receptor antagonists, because these drugs interact with a variety of other drugs. Make sure that the patient understands to avoid operating heavy machinery or participating in critical decision-making while taking this drug because it may impair their judgment and reflexes. It is best to take this drug before you have an emesis rather than waiting until after you've had an episode of vomiting. The patient should understand not to use alcohol or other drugs with sedating effects while they are taking this drug as well. Phenothiazines are a class of an antiemetic drug that reduce nausea and vomiting by blocking the dopamine receptors in the CTZ of the brain. And for this reason, drugs in this class are also called dopamine antagonists. Dopamine receptors are present in many areas of the brain and the body. And as a result, these drugs have many other effects in the body in addition to the antiemetic effects. Dopamine antagonists are approved to reduce nausea and vomiting from many problems except for the morning sickness associated with pregnancy. The nursing implications: make sure to teach the patients to change positions slowly because these drugs can cause orthostatic hypotension. IM injections should be given deeply into large muscles. Remind patients that alcohol may increase the drowsiness and risk of injury. Watch carefully for side effects and adverse effects related to the drugs and their effects on dopamine. Contact the healthcare provider for any Parkinson's disease like tremors or gait changes, muscle spasms, or changes in motor movements such as tongue rolling or lip smacking because these are serious adverse reactions. Monitor the patient closely for any sudden increase in temperature because this can be an indication of a neuroleptic malignant syndrome, a rare but life-threatening adverse effect. Examples of these drugs are prochlorprezine, known as compazine, and promethazine, known as Phenergan.